Mariyana Schoultz, and while I am based at Northumbria University at the moment as an academic, my journey with care homes started about 20 years ago when I started working in a care home as a carer and then as a nurse. So now my passion has kind of been building up for quite a long time about care homes. And it really links up some of the previous talks about burnout of staff, particularly what happened in the pandemic. So this project that I'm going to be talking about to you today, it kind of links really with that because I've seen it firsthand how traumatic it can be to work in a care home because, you know, you're dealing with day-to-day stresses. And that kind of got exacerbated in the pandemic. So it's interesting that when the call came from RCN, you're aware of RCN Foundation, there was a call to evaluate an intervention called psychological first aid in the pandemic for care homes to check, like, is this helping people? Like, we want to see if this is actually going to help people cope better with the pandemic. So we got that funding, and it's really interesting to find out that while we found lots of people around the whole of UK, they have never even heard of it, really. The majority of the people that we actually surveyed, they've never even heard of it. And it was an intervention that was actually free, and it was available to everybody. But those that have actually done the intervention, when we compared some of the stress levels, the depression between them, those that have done the intervention actually scored much better. So their stress levels were a lot less, the depression was better. But also when we interviewed them, we found out that they were more aware of themselves. They started to separate the problems that were happening in the care home from home. So they separated, they managed to kind of do that separation. And also they improved the relationships between them as a team members, as staff, but also with the residents, as well as the relationships at home. So I thought, we're onto something. So we started to dig a little bit more to kind of find out a little bit more information about it. And this is how we actually noticed there was a knowledge gap. So while the psychological first aid is something that was recommended by the World Health Organization as early intervention that provides immediate psychological support and practical assistance after a disaster or critical event or something like that, there wasn't much information about, can this be useful otherwise? I mean, do we have to really wait for something big to happen like the pandemic to check if this is actually going to be useful? Because let's be honest, researching something in the pandemic, it's really hard. And we know from the previous presentation, it's not that easy to do research in care homes. You know, it's really, really tough. So all of that knowledge, and I'll go back again because I want to tell you a little bit more about this. So we kind of seen that, okay, there is a value in this intervention because from the people that have used it, there's been some benefits. But that was a general intervention. It was like for everybody, for all essential workers. It wasn't just for care home workers. And we thought, well, we need to make it more specific because the context in care homes is very, very different to somebody working in Tesco, for example. There might be some similarities, but it's very different. So we noticed that we need to do something about it. And this project is actually talking about this. So we wanted to adapt this freely available intervention and to make it more specific to the context of care homes, but to do that with people that actually work in care homes. Because even though I have previous experience, and the people that were on the team had previous experience of care homes, we don't have the current. So we needed people that are actually working in care homes at that particular moment to help us do something about this. So that's how it started. We got some money from University of Northumbria to do this project, and where we wanted to see, we want to adapt it because we think, for care homes, we think that there is a big role to play to help people be prepared for anything that happens anyway, so we don't have to wait for another pandemic or another, I don't know, crisis to happen. So this is kind of what we started, and let's see. This was the aim, to take this free intervention, to work on it, to kind of see what we need to change with people working in care homes to be more suitable for people in care homes. obviously, it was going to be a qualitative approach because we needed to talk to lots of people. We needed to consult with a lot of people. And gosh, it was very complicated. So kind of for easy way to describe it, we kind of did it over 2 phases where we kind of used interlinked mixed methods, but we kind of had to follow lots of guidance about it. So like we had to kind of use frameworks that we're doing it correctly as well. We're doing it all properly. So I'm not going to go into that much. What I want to say is that we obviously consulted the literature for the first phase. Then we had stakeholders, and I'll tell you a little bit more about them in the next one. And then we had some semi-structured interviews with people working in care homes. And then the phase 2 was the one to identify what actually we need to change from that current free intervention, what we need to actually specifically change, and do we need to change something in the content and the way of delivery as well. So again, we did that with the people working in care homes and with the stakeholders. So who was involved? We were 7 researchers from Northumbria University, University of Highlands and Islands, we have the representative here as well, and Bristol University. We had 18 participants overall over the 2 phases. Some of them participated in both phases because there were different things that we were doing. And all of them were carers and nurses from the whole of UK. So there were people, some from Scotland and some from England. And there were 7 stakeholders. So there was 1 academic, there were care home staff, there was a member of the public as well, and some students that at the same time they were working in care homes. So we thought we had a good representation to kind of see what we need to be doing. I can't even read it from here. Okay, so phase 1 was, I'll just kind of give you the highlights. I want to say that in the lunch break, we actually have a final product that if you want to find me, I'll show you on a tablet how it looks like, because we actually have the whole thing. And this is just scratching the surface of what we've done. So we kind of talked about, what were the traumatic events for people working in care homes? What do they currently do to manage? What kind of activities? And obviously different care homes do very different things. Do people feel supported? What can be done to feel more supported? So we kind of tried to explore that with the literature and the consultations with the stakeholders. And then in the second phase, we actually we did what we call think aloud exercises. So we actually gave the script of that free training for people to read it and to tell us, oh, I don't like this, oh, this should be this should be changed. So basically, we asked people to tell us their thought process about what they're thinking. It was, quite a lengthy experience, but it was really good because we went through absolutely everything. And we had loads of tables of things that we needed to change. So what we did was we grouped things into positive, as in what you should stay, into negative, what we need to be changing, and kind of neutral, well, it can go either way. And I have loads of quotes now. We're not going to read all of them because I know I'm short of time, but they kind of grouped in what were the main areas that we focused in phase 1. And these are some of the quotes kind of that came out of it. So I know I'm a little bit short on time, but you will be able to see these afterwards. So spend your time, if you can read at least a couple of them now, because I've got more of them to show you in the next one. But they're shorter, I promise you. I think we'll be more equipped to look out for each other, support each other, and then maybe even build up the relationships, which in turn is going to be better for the team working in the job role as well. So, 1 more minute, okay. Phase 2. So these were some of the positive stuff that came out that they actually liked, what was already there, okay? And these were some of the things that they didn't like, and we kind of had to change to make it more suitable for care homes. So it was to do with the scenarios, it was to do with the activities in the actual thing. I should say this is an online intervention because our resources didn't allow us to do anything, to develop anything that will be face-to-face. So it's kind of for online. And as I said, in the lunch break, if you want, I can let you try it out, because what we're doing at the moment is we've got the product and we're testing it again with another group of students to give us more feedback to see what else we need to change, because it's a very lengthy process to see how we can make it better, and hopefully we'll make it available freely for all care home staff to be able to use it one day. That's kind of the long game. Summary, and this is some takeaway messages from today. One of the things is prioritize your well-being, which I know you already know, but is what can you do to actually prioritize it? Because without us being well, isn't it? How can we look after other people? It just doesn't work. But it's easier said than done, isn't it? We need like support and systems around us, managers and everybody else to actually agree on that. Recognize training gaps. I know people there's so many mandatory trainings, so you're thinking, oh, is this another training? That, so doing something that people can do when they're ready to do it, I think it's really important, not just kind of making it compulsory. Embrace psychological first aid. I know the name can be a bit scary, but trust me, it's a very simple intervention. Engage in continuous learning, which I'm sure you all do anyway, and foster cultural support. And I know that already happens, but it's just reminding ourselves, isn't it, to be supportive to everybody that we work with. And that's it.